Did you know the number one predictor for a heart attack or heart disease actually isn't high cholesterol? I couldn't believe it either, but when I started to dig into the research, I found that 50% of people who have a heart attack actually have normal cholesterol. And of course, 50% that have a heart attack have high cholesterol. So I started to look deeper, and what I found was the missing number that physicians and doctors and cardiologists are testing for is specifically inflammation. And even more specifically, it's a high omega-6 fatty acid called arachidonic acid. And the reason for this is that as you become more inflamed in your body, believe it or not, your arteries, which look a little bit like this straw, begin to collapse. They get tighter and tighter. And so if there's any plaque in there as you get older, the blood flow cannot move through. And when blood flow can't move through an artery, then you have a heart attack. And so what I want to share with you here today is that decades before a heart attack may even occur, is you can test for that high level of omega-6. You can test for arachidonic acid right at home. It might be even more important is your levels of omega-3 and EPA that balance arachidonic acid and high levels of omega-6. So by now, you probably know that high levels of omega-6 come from, let's just say, conventional-based meats and roasted-based nuts and seed oils. But what you might not know is that so few of us have optimal levels of EPA, which is the most anti-inflammatory omega-3. And the reason is the only real way to get EPA is through fish. And not just any fish, it's actually through wild salmon, wild trout, mackerel, anchovies, and sardines. And if you're not eating these, especially with the skin, you're not getting the EPA, the omega-3s that you really need. Yes, you can take in chia seeds, you can take in flax, you can take in a few other things, but they don't convert really well. They convert between 6 to 14% maximum from ALA down to EPA. So my goal for you here today is to be able to find out your risk factors and honestly, very easily, within 6 weeks to 8 weeks, rebalance your levels of inflammation in your body. So here's what I have all of my clients do. It's a very simple at-home lab test. And before we get to that, I want to share with you the average American is about an 18-to-1 from omega-6s to omega-3s. We want people in our practice that are working on balancing their overall health, battling chronic disease, and also working on anti-aging and longevity to get their number down to a 3-to-1. So 3 parts for omega-6 and then 1 part for omega-3s. You can go a little lower, but believe it or not, in nature, we actually want closer to a 3-to-1, maybe a 2-to-1. As I said before, even healthy people in my practice are typically a 6 to 8-to-1. So there's work to be done. I can share with you how to correct those as well, but knowledge is power. So my goal for you right now is to look at how you're able to figure out your level of omega-6 to omega-3. The best way to do that, simple at-home lab test. This gets shipped directly to your house, and all that it is, I'm just trying to demystify it, is a simple blood spot card. So you do a small finger prick right here. That's all there is, ages 3 years old and up. And you just drip 1 drop, 2 drops, 5 drops total. Let this dry. It comes with a pre-packaged mailer registration card, and all of your results are kept private. Goes to the lab, goes to your practitioner, and the results come to you. It will let you know where you stand, what your risk factors are. I'm going to share with you numerous studies in the description below, but what I want to share with you right now is that anyone with a saturation rate of omega-3s in their blood below 9% is at risk for higher levels of cardiovascular disease or a heart attack in their 50s, 60s, and beyond. So by simply getting enough EPA and omega-3s, we can reduce sudden cardiac death by over 90%. And again, I'm going to link those studies for you below. So you want to get your number, and then after that, you can get a simple customized protocol of how much fish you need to eat per week, or if you're not someone that likes to eat the wild salmon, wild trout, sardines, mackerel, anchovies like not a lot of my clients do, then what we can do is we can opt for using 2 grams or maybe 3 grams of a good omega-3 fish oil that is triglyceride bound, that's been tested for heavy metals, and that is safe for use. Within 6 to 8 weeks for the custom amount for you, you'll be able to reduce your levels and honestly check that box for inflammation inside of your arteries so that you reduce systemic inflammation so you do not have those shrinking arteries, and that will give you the peace of mind that you need in order to be able to live a healthy, strong life. So if you'd like to run the lab test through us, you are welcome to. You can simply go to stevencabral.com/heart. You'll be able to sign up right away. We offer actually about 100 of these per month, ship it directly to your door. You get the results in just a couple weeks along with a personalized protocol. Again, that's stevencabral.com/heart. I'll link it up in the description. Hopefully that was helpful. Let us know if you have any questions. We're here to help.